Hello, welcome to the very first podcast of Pelvic Pain Unpacked. My name is Tamar Hill. I'm the CEO of MedRoots, and I have with me here a very special guest, somebody near and dear to my heart, personally, professionally, my sister, Dr. Charity Hill. Welcome!
Thank you.
Now, this might be a little weird because she's literally sitting right here next to me. So if I look this way and I'm looking at her, you're like, why are you looking off camera? Anyway. So this podcast exists for one simple reason, and that is pelvic pain is real. It's incredibly common, very taboo for many years to talk about, and it's really uncomfortable for people to talk about. And so this is what we're here to do, is talk about it. And why is my sister here, Dr. Charity Hill? We want to change, why it's hard for people to talk about pelvic pain. It's obvious, we were always taught growing up, these are your private parts. We don't talk about private parts. But Dr. Hill, why do we talk about private parts?
Oh my goodness. So, about 1 in 8 people have pelvic pain, men and women, and it's just underdiagnosed, it's undertreated, and it's a huge physical and mental burden on people who suffer with this and aren't able to get any relief.
Now, you said 1 in 8. I've always heard the number 1 in 10. Is the number increasing, or is it has it been underdiagnosed?
I think
so
it's
we're seeing a shift.
Yeah.
All right. And when we say pelvic pain, what does that encompass? Because obviously the pelvis for men and women, there's different stuff going on. But what are we talking about when we talk about pelvic pain?
I pretty much am talking about anything from the belly button to the inner thighs. Anything in that whole region there, I'm going to classify as pelvic pain.
All right. So tell me a little bit more about your background. I mean, obviously I, as your sister, know your background, but you're a physiatrist. Tell us where you went to school, what is a physiatrist? Because most people think that that's a fake doctor.
Yeah. So physiatry is a small branch of medicine developed after World War II to help rehabilitate soldiers coming back from war. The whole point of physiatry, or physical medicine rehabilitation, is to maximize function and ability of the body. And so that encompasses everything from spinal cord injuries to amputation care to management of pain conditions and neurological conditions.
I know that your particular branch did some injection therapy and so on, but what was the other solution for, and I'm talking very general, I think you were prescribing a lot of opiates, correct?
I never loved opioids for this, but that's what gets given when you go into the ER. That's what people are given. Valium suppositories are honestly you're almost lucky if you're getting someone who's giving you a Valium suppository, which is a benzodiazepine, which can be sedating, can be habit forming theoretically. But honestly, you're lucky if you even get to that point. But I still didn't feel like it was an optimum solution. But you're just kind of grasping at straws, like, hey, what can we do to get these people with real pain some real relief? A lot of people did get stuck in the opioid cycle just because this pain is so debilitating. And doctors were kind of frozen because they're like, well, we don't see anything on the imaging. We don't see anything on the labs. We don't know what to do. We'll throw opioids at it. And it kind of creates a vicious cycle.
Absolutely. So essentially, I think, and I would say I'm very fortunate. I have never had pelvic pain in my history. My problem is skin related, cancery stuff. But I've been very lucky to have mild periods and everything in between, but this is not the case for most or many women. And I think the goal of this podcast is ultimately we don't want anyone to feel alone. We want you to be able to find a place where you can get answers from real professionals, and I don't think I'm a real professional in this by any means, but I do have a product that seems to help people. And the other thing is we don't want anyone to feel like they're broken. There's no other options. And also that they don't need to feel embarrassed to talk about this pelvic pain and the issues that it can create, because it can really affect people's day-to-day life, right? Confidence, sleep, everything, right?
There's so many systems involved in that area of the body, and all of them are, somewhat taboo. Like, I can't pee. It hurts when I pee. It burns when I pee. Like, who do you want to tell all that to? I can't poop. It hurts when I poop. It bleeds when I poop. Because the muscles and nerves of that area are around all these other organs and systems, it can really spiral into a multi-system complicated thing that it's hard to find a doctor or professional to help you unravel all of that and get through all that.
The whole point is nobody knew much about the endocannabinoid system, and we're still learning, right?
Still learning.
It was only discovered not too long ago, so it's really exciting what we're going to learn about the future of the endocannabinoid system, and hopefully with the deschedulizing of the drug, we're going to learn more about its potential benefits, I think is the end all. And how does that relate to us? Because we sell CBD products that are potentially going to be banned if they don't figure it out. Come on, Congress. Get it together. Trust me, nobody's getting high off of suppositories. There's a lot better ways to do this. Right?
Well, speaking of suppositories, the other issue we run into with CBD products are people telling us, like, well, I've used CBD and it didn't work. And I got it at Whole Foods. I got it, at my sandwich shop and
or my gas station.
At the gas station. Or it did make me feel high because I might have gotten Delta 8. But really, it depends on the spectrum of what you get. Like she said, CBD isolate, I really think is not as effective, especially for severe chronic pelvic pain conditions. And the other is how you get it into your system.
So important.
So important.
That's another great episode. Let me write that down.
Okay.
Types of CBD.
Yes. And for example, I had a patient who kept getting readmitted when I was on my intern year for an infection in their skin. And they would get on IV antibiotics. It would get better. We send them home with the tablets. They kept coming back in. And finally I was like, okay, show me how you're taking the tablets. And he was rubbing them on his cellulitis. So how you taking the medication really matters. Because if you're not getting the CBD into your body the right way, it's the same as rubbing an antibiotic pill on your cellulitis. So it really, that's just a broad example of why someone might be like, hey, CBD didn't work for me, but you were putting it into your body the wrong way or an effective way.
So now that they can go through physical therapy and kind of get past those issues and use their dilators and reduce the inflammation so that the structural changes need to happen so they're not in pain chronically anymore. Well, what % would you say is effective for the patients you saw?
I'd say at least 70, 80 are going to get a significant reduction. And maybe more than that would get some reduction. It's so hard because it's such a large, what I would say, a basket of goods. Where I said with pelvic pain, it could be anything from hip arthritis to endometriosis to a hernia. So if you have an ongoing inflammatory condition, like an active hernia or a core muscle injury, then you may not get as drastic of relief as if you're just kind of stuck in a rut of a chronic pain cycle. So I would say it depends, but a large proportion will get a significant reduction in pain, which helps us isolate, because when it becomes this storm of pelvic pain, it becomes really hard to isolate and pinpoint what the actual instigating factor was. And sometimes we never figure it out really, because a lot of times the instigating factor is long gone by the time
just
people
left
get
with
to
the
us.
storm.
We're left with the kind of the ongoing storm. And so, yeah, I would say it's highly effective for most people. Some people are non-responders, and I think that has to do with the varieties of people's endocannabinoid systems and how those are different, why people respond differently to different antidepressants and things like that. I think comes into play there.
Oh yeah, I've had a really interesting conversations with some people that are like, none of this stuff works for me. I can't even get high. I've tried. And they told me everything they did to get high. And I was like, what? That would kill a rhinoceros how much THC you took. I don't know. Not that you could.
Some people are non-responders.
So I was just like, oh my gosh, that would be insane. So it's very interesting too that some people, like you said, are non-responders. So we can get into that in another episode too. If you want to hear about that, let us know.
We also have some people who are super responders.
Super responsive.
Yes. And
oh my gosh.
it's just immediate and unimaginable relief. Immediately, and they're very happy, obviously, if you get a super responder.